Now, the National Association of Sachet and Packaged Water Producers have described a recent study by the Ghana Statistical Service, which found appreciable levels of human excreta in a lot of sachet water on the Ghanaian market as unmeritorious and one that lacks clear motive. The association says the report is a malicious attempt to destroy a thriving industry and one that is targeted at drawing populace attention to the Ghana Statistical Service. Here is a news desk report on that study.
10. Pipe-borne water was pegged as the main water drinking source in most homes in Ghana, but the figure is reported to have reduced from 46.5% to 31.7% over the last decade, with sachet water becoming the preferred source of drinking water. According to the 2021 Population and Housing Census, about 37% of the 8.3 million households in Ghana consume packaged sachet water as their main source of drinking water. The figure represents a quadruple increase from 9% in 2010. The consumption of sachet water is said to be prevalent in urban areas, with 5 regions cumulatively recording higher rates than the national percentage points. Greater Accra region recorded the highest use of sachet water for drinking, while the Northeast region was the lowest. However, the Ghana Statistical Service is worried the figure poses a public threat as a number of water sources for packaged water production have been found to contain fecal matter. Assistant Chief Statistician with the Ghana Statistical Service, Dr. Peter Tichipepra, was speaking at a stakeholder engagement in the water, sanitation and hygiene sector.
We need to pay attention to those who are into the production of sachet water. We tested the source of water for the household, where we realized that certain percentage of water is being contaminated with fecal, or I'll put it, fecal contamination. Fecal contamination simply means we have toilet in our water.
The engagement in Kumasi was to keep stakeholders in the wash sector abreast of the findings from the census to inform policy. Dr. Tichi is therefore admonishing thorough examination of produced sachet water on the Ghanaian market.
As a country, we need to encourage the FDA to embark on thorough monitoring and supervision. They should try their best to test on a regular basis the sources of water in the production of these sachet water.
For JoyNews, Emmanuel Bright-Kweku reporting.
Now, the association says this report is a malicious attempt to destroy a thriving industry and that is targeted at drawing populace attention to the Ghana Statistical Service. Now, in a statement released on Wednesday, the association has subsequently rejected the report put out by the Statistical Service. So the question is, why is the Association of Sachet and Packaged Water Producers rejecting this report? Joining us is the president of the association, Magnus Nunu, to help us with more answers and reasons why they are rejecting this particular report. Magnus Nunu, thank you so much for joining us here on the JoyNews channel. Let us understand why your association says they won't accept that report put out by the Ghana Statistical Service. All right, so the report there by the Ghana Statistical Service indicated that majority of the sachet water on the Ghanaian market, a study proved that they contained an appreciable level of human excreta, which means that there are some fecal matter on that. Let's go to Mr. Nunu to get some answers. Mr. Nunu, thank you so much for agreeing to join us here. Why is your association say you won't accept that study or that report put out by the Statistical Service?
Hello?
Mr. Nunu, I can hear you. Can you hear me?
Yeah, please. Were you asking a question? I can hear you now.
Yes, so I was asking on which grounds is your association rejecting that report put out by the Ghana Statistical Service?
No, we have a couple of them. My greetings to your listeners and then your viewers. First and foremost, I mean, the cluster survey was done way back in 2017. And so one wonders why you waited for 5 years And then on a very different forum, not related to the topic at all, then you try to release this bombshell. And you see, in your own reportage or report that you could have put forward, you indicated that, listen, I mean, if you come to the urban population, as much as 72% of the population depend on this product. And then you come there and he, excuse my word, he went further to explain that this is, if you don't know what it is, means shit in water. I mean, how do you do this? This is an irresponsible statement. That's the first one. Number two, if you have done a research like that, and then the main source of water supplying better than the national supplier, right, to the magnitude you have, and it's contaminated, then it must correlate to certain health figures, like epidemics or so, cholera or whatever. I can't collect if there has been any epidemic within the past 5 years. I mean, apart from the COVID. The COVID is not epidemic, it's pandemic. You know, so you could have this, you could have done some research on it, like, okay, over this period, we're having that an epidemic, cholera outbreak was there, or typhoid went up by these figures. Then you can correlate. But then to do a one-sided research and throw it into the public domain, and somebody has depended on this water for the past 5 years, so telling that all along you were drinking, excuse my word, and they use the word toilet and shit. I mean, it is so bad. I mean, this is a very shoddy work, which you must look at it and then get it done properly. And then, I think that's about that. We can't shout loud, but then the motive is not really clear, you know. The motive is not really clear. Why he has to do something like that.
But Mr. Nunu, I mean, they have put out this, which means that you should be addressing the issue of processes. How is your processes able to take out any fecal contamination that is in your source water that you use in producing this sachet water?
So now the question, how have we been doing? Now, in the first place, for me to treat water, you know, water, you don't do anything to it. You go to the source, you pick it up, you test the raw water. You know the level of contamination. Now, all of us in the water industry, no matter what, when you start, your starting point, you start with a point of contamination. It could be anything. He has only mentioned one, but there are numerous of them. But you start from there, and then you process it, then it becomes potable. So it's not, you see, if we say the source water is contaminated, in the first place, we don't package source water. We package processed water. So if the source is contaminated, it's not a big deal because it is almost always contaminated. Then we pass it through a series of filtration media. Very, very strict. In the end, what you get is potable water. To be very honest with you, like I said, 95% in Accra we use Ghana water, and I don't make Ghana water. But then if you check the raw water, it is not even the best, to put it that way. Normally, sometimes we even have microbial load as high as TNCC. But then by the time we process it through our reverse osmosis system, which is the ultimate filtration system, by the time it is done, it comes out potable. Now, let me even relate. I'm not even going too far. Are you aware that even right where they're in Sachet, the source water they are using is seawater? High levels of TDS and then other issues which are not but then they process it through whatever it is. That's what they're supposed to do. In the end, you get potable water. So if you come and say that the salt water contains one of them, you have to there are other more there, and we all start on that point. We process it. But if you are told that my final product, after I have done all these things, contains what it's talking about, then we have to worry.
But can you also, you know, be confident that all the producers are following processes to ensure that fecal matter in any source water they are using is out? Can't you also agree that there may be some of you who probably have issues with processing, and therefore, when you do a regular check, you may find these elements in there?
That's what I'm saying. Now, what are the systems in place to check that? Now, we have a very, very solid regulator called FDA, Food and Drug Authority. They are very strict. and they are there to protect the public interest. What they do is that, listen, everybody, whether it is food or water or what have you, they are there. They have to give you license before you drop the first water on the market. So then every product by brand has an ID number stated on the product. You are supposed to, by law, go to them, or they will come to you unannounced and review your certificate once yearly. So what the time they did the cluster survey and then releasing the results by years, if you pick an average company, FDA might have reviewed their operations about 5 times, and they do that on a daily basis. Of course, if they realize that they don't come to publish it, right? They could not come to publish, so they might have stopped some of them, they might have corrected some of them, they might have, all that they are talking about, it's already being done. Just that I don't know the motive, because we are people from.
So Mr. Henry, you agree that there may be, what you're saying, you agree that there may be some infractions along the way, isn't that the case?
And that is why the FDA is there. And the 1 year, you have passed the first one. Within 12 months, you have to go for a review. Everything comes to zero. You start all over from point 1. And they come there in person, just like you renew your bells, right? You take the card there, physically for them to examine. This one, so they come, there are 3. They come to your premises, and you go through all the processes again, from testing microbially, testing the workers, and the end product is there. After that, there is what we call market surveillance. So we have quite an airtight situation, to forestall this. And I've said, we shouldn't dwell so much on that, because the man is talking about our source. Our source normally it's not clean. I mean, let me put it that way. We start from a point where it is not clean, and then we pass it to this process. Now, for your information, previously when we started Sachet water, you could use anything at all, like you could use microfilters and food. Now, the standard level they use is the ultimate. And then the ultimate has been broken down, so you can just get a 1 tonner RO system, 2 tonner, up to a million tonner.
All right, Mr. Nunu. My final question is, what are you going to do now? Now that this report is out, you are challenging
so
it. What's your next line of action?
We have to discount it and tell the public that, listen, what he's saying doesn't apply to the one you are drinking at your home. No. So he's talking about where I start from. And where I start from is sometimes like that, but then I end up better. So what you are drinking has nothing to do, it doesn't contain fecal matter. It doesn't process. It does not. Otherwise, you see, what as the medical officers.
Well, Mr. Nunu, I'm grateful that you could find time to join us on our news. Magnus Nunu is the president for the Association of Sachet and Packaged Water Producers.